The pandemic, I think, has probably hit our communities the hardest.
COVID has run like a hurricane through our Black and Brown communities, and those are the people that we serve. About half of our participants are 55 and older.
People who are really, really poor, really living on the edges. They have less access to quality healthcare that would address sort of the chronic issues that we found out makes you really susceptible to the COVID virus. We're a 150-year-old organization. We're 500 employees at least. To turn an operation like that around in a week, to working remotely, working from home, reaching out, using technology in every way we can, we've created community even from a remote situation to engage people and create connections with people to help them survive.
We provide youth development and tutoring, homework help, mentorship. We are virtually connecting with families and community members and participants. We try to come up with fun, engaging ways to keep their spirits positive. We post fun YouTube activities. We post TikTok videos. We host graduation parties for a lot of the participants.
PRO stands for Personalized Recovery-Oriented Services, and we provide psychiatric rehabilitation services to adults living with severe mental illness and co-occurring disorders. Prior to COVID, everything was on site. We work with a lot of vulnerable people who not only have behavioral health issues, but also pre-existing health conditions. During the COVID crisis, we really had to strategize to ensure that we were providing medication management to those people who depended on it in a safe way, and that we were utilizing telehealth as much as possible.
TLC stands for Transitional Living Community, and we are a transition community that serves women who are homeless and also have a diagnosed mental illness.
I'm a vocational and educational specialist at TLC. My role is to help clients with education and employment, SSI, SSDI, but also making sure there are ways to engage and learn every day in the shelter so that clients aren't just sitting here statically, not working on their life, not creating goals.
We do a lot of group and recreational activities. Now we only allow 8 to 10 women in the group at a time. We've had educational groups about COVID, how to protect yourselves, a lot of teaching them how to wear masks properly. COVID-19 has changed, in my mind, it has changed the entire way that we're going to deliver services to our clients moving forward. Our main priority, to place them in permanent housing, that they're going to continue to have virtual interviews and virtual housing viewings. No longer can a client just walk in the office and sit down. Now it has to be a process. Like, we have to disinfect the area because the other client, we have the plexiglass, do the client have on the mask? So we have to think about protection before social service.
We sanitize the entrances, the doors, the table, the open area where they sit at, and the offices, because mainly they're in the doctor's office or the nurse's office. Those offices we maintain complete sanitation after every visit.
And many of our participants were saying, hey, I don't have antibacterial, I don't have a face mask, I don't have gloves. And when you ask what they need, they're telling you that those are the same things that they need. Our program has really worked with central services to make sure that we do have adequate masks and antibacterial on site.
BCS has been so amazing. They were able to get me everything that I need to continue to protect the staff and the clients.
Organizations such as BCS are quite essential to those of us that are on the front lines during this COVID crisis, because they've been able to provide essential resources for us to be able to get funding.
We have been working with Brownsville Culinary Community Center and the Collective Fare Catering Group to obtain funding to distribute meals to elderly residents right there in the Brownsville area. They had an on-site kitchen, and they had people who knew how to cook and who knew how to prepare really high-quality, nutritious meals. And so we were able to partner together to get funding to be able to get those meals to really vulnerable groups that we're working with.
We knew that access to food was going to be something that was going to hit home. So we wanted to create a model that was going to be able to sustain people during this time, starting with the seniors, then moving on to people that were in family shelters and those that are in need, people that were immunocompromised, people that have illnesses. We're working along with BCS to provide 2,000 meals a day, which is 8,000 meals a week, and 1,000 grocery bags a week to people that are dealing with food insecurity and our essential workers.
It is hard for folks to stay locked up in their houses. And so, they are joyful when we bring this food to them.
Being able to come into the office on Fridays to manage the clinic, it's so nice to see someone who comes and say, "I've missed you. I can't wait to come back. It's so good to be here." It reminds me a little bit of how meaningful we are in the lives of the people that we serve.
I was speaking to a parent just yesterday, and she was really moved on how consistent we were with calling her and just checking in, seeing if she needed anything, and telling me how much her child is engaging and enjoying our virtual experiences that we provide for them. And just to have that little small talk, it gives her hope that this too shall pass, and we will be there helping our community get back on top.
Unfortunately, this thing has us all apart, but if we work apart, we'll stand together.
How do I feel about being an essential worker? I love it. How can I work remotely when I have clients that need us? We're in this together. Who would be here for them? They see me come to work every morning with my mask, telling them to put their mask on, but nevertheless, we're here. Like I told them, we're here for you.
I'm terrified every day. I'm terrified leaving my apartment. But as I said, what keeps me going is knowing that I'm in a position where I can serve my community. It gives me the strength to keep fighting.
In the beginning, it was very scary, but as you thinking of yourself as an essential worker, you have to realize you have to put your fear behind and begin to know that you're doing something to help yourself along with others.
I have people that live as far as the Bronx that come all the way to Brownsville and work along with us to produce these foods for the people. We have a great many people and staff that were very scared, but they trusted in us and they believed in us, and they are continuing to work along with us during these times.
The challenges that this population will face after COVID, I don't have an answer for that one. There's nothing to reference to. There's no data. We're living and making history at the same time. There is no answer. The answer is we have to create every day.